You're listening to the Assembly on Clinical Problems podcast, brought to you by the American Thoracic Society.
Welcome to the second Clinical Problems ATS Assembly podcast. I'm your host, Dr. Kerri Johannson. I'm an associate professor in the departments of medicine and Snyder Institute for Chronic Diseases at the University of Calgary in Canada. I'm a longstanding member of the Clinical Problems Assembly. And today's podcast is Clinical Problems Assembly Roadmap for ATS 2025. I'm fortunate today to have three esteemed guests joining us. I've got Dr. Justin Oldham. He's an associate professor of medicine at the University of Michigan, and he is the chair of the Clinical Problems Program Committee. Dr. Surya Bhatt is a professor of medicine at the University of Alabama at Birmingham, and his role in ATS this year is as chair-elect of the Clinical Problems Program Committee. And Dr. Kerri Aronson is a professor of medicine at Weill Cornell in the Division of Pulmonary Critical Care Medicine and is the Science and Innovation Center representative for our Clinical Problems Assembly. Thank you all very much for joining today. I'm looking forward to this discussion.
Great to be here.
Thank you for having us.
Thanks. So hopefully the goal of today is to really lay out and highlight Clinical Problems Assembly content and stuff that would be relevant to our CP Assembly members. So like some peripheral or related content or things that will be of interest at the upcoming ATS conference in San Francisco. So I thought that we could start off with the program committee, and maybe someone could just give a little introduction, sort of what is the program committee and how does that tie into the ATS conference?
Yeah, I'm happy to do that. So like all ATS assemblies, the program committee or the Clinical Problems Assembly has a program committee, which is responsible for essentially reviewing all of the content that you're going to see at the next upcoming ATS International Conference.
Perfect. And so it sounds like one of the biggest assemblies in ATS with lots of content to review and program.
Yeah, definitely one of the largest, if not the largest, based on the number of abstracts we get. But yeah, the content includes the scientific symposia that you'll see, the Meet the Expert sessions, the postgraduate courses, and then all the abstracts and case reports.
Perfect. So there's probably going to be loads of content, clinical problems, programmed and or related. The conference starts May 16th, so it starts off with the PGME courses. Are there CP assembly related courses happening this year?
Yeah, we've got a few. So two didactic-based postgrad courses, one focused on ILD, the other on lung transplant. And then like most other years, we've got a hands-on course that's focused on bronchoscopy.
Anything specific in the COPD world, Surya?
Yes, there's also the clinical year in review course, which is the talk, which is on the Wednesday of the conference.
Yeah, we have an ILD clinical year in review that's going to be on Tuesday.
Yeah, and clinical year in review is always, I think it's one of the best sessions, or certainly most well attended, and they've expanded, I think, over the last couple of years to really cover lots of different topics. So the ILD and the COPD ones for sure are always like hard to find a seat in them. So you'll be sure to attend those on Tuesday and Wednesday morning.
And I can put a plug in for the postgrad courses because those are really wonderful. I was a part of the ILD postgrad course, and it's really just excellent. I learned so much. So that's great.
And they're really good, not even just for early career, but for sort of established, it's really hard to keep up on all sorts of.
Oh, yeah.
It's really good.
Yeah, the crowd is actually quite diverse at those. You get people who've been practicing a long time and trainees just starting their fellowship. So it's a nice crowd, and some of the biggest experts in the world giving the talk. So it's definitely worth attending if you're going to be there on the Saturday or Friday.
And great opportunity for discussion too, not just like lecture format, but also opportunity for discussion. And so it's a great way.
Justin, maybe you can take us through some of the interstitial lung disease specific topics. I know clinical problems encompasses quite a lot. The biggest chunks are probably ILD and COPD, but then of course there's pleural disease and interventional pulmonary medicine, some bronchiectasis. But maybe, given your expertise with ILD, what would be some of the biggest highlights at the conference this year?
Yeah, you're spot on. Clinical problems basically comes down to a pie that is probably 40% ILD, 40% COPD, and then the rest being, IP, some transplant and practices. For ILD, we've got a bunch of content program this year. So we've got several outstanding mini symposia coming up. One on pulmonary fibrosis, what progress we've made over the last 5 years. We've got a very cool pro-con debate going back and forth between the current definitions of ILAs, IPAF, or interstitial pneumonia with autoimmune features, and then progressive pulmonary fibrosis, all of which have some debatable definitions that our experts will argue one side or the other for. We've also got symposia on gleaning through the omics lens, LT biomarkers, and with a sort of a slant towards clinical utility of those. So that'll be interesting. And then we've got one that will be focused on disentangling the role of comorbidities in ILD. We've also got a bunch of original research, as you can imagine. For the research symposia, we've got one focused on advances in ILD management. That's where we'll see some of the clinical trial data that are not presented in the New England session or the clinical trials symposium. We have one on ILD biomarkers, which will be exciting. This includes kind of everything from clinical biomarkers through omics, through imaging biomarkers. And then we've got a dedicated session on the Wednesday focused on advances in ILD imaging. Beyond the symposia, we've got a bunch of thematic poster sessions and then 3 poster discussion sessions, which are all focused on ILD and primarily on new treatments, phase 1-2 trial data, along with some other biomarkers and some epidemiology. So every day, you basically can't walk into that conference without seeing CP original research or posters or case reports.
I need some good walking shoes.
That's right.
Getting around to all these sessions. Yeah, it's hard not to miss out on some of the good content. Fantastic. And then Surya, could you fill us in on some of the COPD related content that's going to be at ATS?
Sure. Lots of exciting sessions in COPD as well. We don't have the same alphabet soup issue that ILD has, but there's lots of concerns about diagnosis. So we have one session, which is a pro-con debate on the diagnosis of COPD. We have big issues about whether to use the fixed ratio or the lower limit of normal. And then PRISM, pre-COPD, all kinds of new terminology coming out in COPD. So there'll be a huge debate about the pros and cons of these new terms. And there's also a pro-con debate, which should be very exciting on what's a very hot topic in COPD. That's on type 2 inflammation. So there's different terminologies here as well. Eosinophilic COPD or COPD with type 2 inflammation, what's good and what's not. And I think there's going to be a good debate on that. We also have a symposium on clinical trials in COPD. So our trial design, endpoints, and also some clinical applicability of some of these endpoints. So that should be a good set to watch out for. And then we have a bunch of original research sessions. One is on primary and secondary results from clinical trials in COPD. So these are really exciting times to be in COPD research. So there's a lot of readouts of large clinical trials. And then the ones from the years, the last 1 or 2 years, there's a lot of secondary analysis of those trials, which have shown some really interesting results. And then there's a research symposium on advances in COPD, both translational and clinical advances. And then there's a session on lessons from clinical studies in COPD about, how to predict response, phenotyping, imaging, physiology, all things related to COPD in that session. And there's one session on biomarkers and predictive tools in COPD, again, related to how do we predict which person's going to respond to what treatment, and also prognostication. So that should be a good one as well. There's a lot of AI in several of these sessions that should also be interesting for people with more of an engineering bent of mind. And then we have 2 COPD poster discussion sessions and a lot of thematic poster sessions also that focus on COPD.
That's fantastic. I want to put a plug in. The pro-con debates are always super fun and controversial, and again, really well attended. Like there's going to be a lot of information, like even in the great research in the thematic poster halls. So always great to walk through. You always run into people that or make new colleagues, but then you can find some like really interesting stuff that wasn't otherwise programmed in a sort of bigger session. So Thank you. That sounds great.
And one thing I like about thematic poster sessions is when you walk there and you have more time to talk to the presenters than you would at other sessions. So those are always interesting to get to talk to people.
Totally. Any questions without having to, have your heart walking up to the microphone in one of the discussion sessions. You can actually just have a conversation. And so out beyond ILD and COPD, what any other highlights from clinical problems assembly content?
Yes, we've got a lot of other content too beyond the two sort of big pieces of the pie. We've got a few mini symposia that don't really fit into either the ILD or COPD bucket. One on AI-driven innovations in basically chronic lung disease, which will span ILD, COPD, and other topics. We've got one on manifestations of ANCA vasculitis, which is not just ILD. You obviously can get airways disease, bronchiectasis, that sort of thing. One on navigating the landscape of home ventilation, which is obviously very important as more patients are surviving their hospitalization. We have a pro-con debate on non-malignant pleural disease. So that will be very interesting. We've also got poster discussion sessions on rare lung disease, sarcoidosis, and transplant kind of together as a combined session. Advances in interventional pulmonology and pleural disease. And then we've got a handful of different poster discussion sessions on kind of the most interesting case reports that we came across this year during our programming. So no shortage of content. There's going to be a lot of great stuff this year.
Yeah, I'm starting to think the meeting should be longer. Awesome. Thanks you guys both so much. I think maybe next we'll move on to Kerri Aronson. It's so nice to have two Kerris that spell it the same way on the same
Yes,
podcast.
we love that.
And when I think about ATS, I always think about all these things that we've been talking about, which is like scientific symposia and meet the experts, and put the thematic poster hall in discussions. But there's this Science and Innovation Center, and I think that's been relatively new over the last couple of years. And some of our listeners here might not be familiar with it. So I was just wondering if you could sort of tell us what the Science and Innovation Center is, and why we should go.
Yeah. So it was new to me also as of about a year and a half ago when I joined as the representative for clinical problems. And it's really just very interesting and excellent. So it's a group that organizes sort of a cross assembly group. So there's representatives from each assembly that help to organize, highlighting different basic translational and clinical scientists across ATS. It's a venue where researchers and scientists can network and learn really more about emerging methods and technologies that advance research in pulmonary and critical care medicine. And so each year, ATS members that are part of these assemblies have the opportunity to submit proposals separate from the proposals that we've talked about already that are programmed. So these are separate proposals to speak about their area of expertise and innovative research methods. So this could be in basic, translational, and clinical. And then a number of these are chosen to be presented within the Science and Innovation Center, which is sort of within the conference, but separate than the other conference program that Justin and Surya have spoken about. And so these are presented in the Networking Super Center, sort of as the broader overarching place that the Science and Innovation Center sits within. So I think that's where people sometimes get confused, and where I had gotten confused is sort of like, what is this and what's the difference? So the Networking Super Center, I think we've all probably if you didn't know you walked through it, you've definitely walked through it, because it's usually in an area where you're like walking sort of between one part of the conference to the other that is usually very high attendance. So you're walking through that area, and it's usually the area that has a lot of couches and coffee and different like sort of table set up. And last year, sort of in the back of that is where there was presentations given. So there was basically chairs set up and a stage, and people are giving presentations just like in the other halls where people will give presentations or rooms. But it's kind of more open. And so that's the whole Networking Super Center. And within that, the Science and Innovation Center are these research presentations. And then in addition to that, there will be other sort of the Networking Super Center puts on that are more about mentorship and career development. And so it's all sort of mixed in together. And so it's a really great opportunity for attending those presentations, but also for formal and informal mentorship discussions and collaborative discussions. And then the Science and Innovation Center also separately at the conference holds a PhD reception and also provides awards for the abstracts associated with some of the SIC submissions.
No, I didn't actually realize that you could submit them as a whole separate thing that's separate from
Yeah.
conference. Oh, that's amazing.
And they're due usually later. So the other thing is, the proposals that are due sort of for programming, the conference that we think about traditionally are sort of due a lot earlier. But these were sort of more later in the fall, actually, that the submission deadline. And I can't give it exact because it kind of changes every year, the exact timing, but it is a later submission time as well.
And then that's fantastic. And then do you like sign up to attend any of these? You don't have to register for it. You just like plop yourself in and be like,
No,
this
you
is
just show up. Yeah.
good. Sounds like it
Yeah.
really is like more kind of interactive, hands-on sort of smaller group type sessions.
Yeah, exactly. Yeah. So, there's space for a lot of people, and they actually are pretty well attended. Last year, the sessions that I was at and moderated were actually very well attended. And then afterwards, there's sort of opportunity for everyone to kind of stand around and discuss and areas that you can do that. So it was really nice to see some of the work that people are doing and presented at those sessions.
And is there clinical problems specific programmed or like, CP adjacent / related stuff or things you want to highlight that we should go see?
Yeah, absolutely. So I think that I would call it CP adjacent, kind of more clinical on the clinical realm. Some really interesting stuff that's being presented this year. So there's a couple of presentations on novel methods and approaches to clinical trial design, specifically around COVID, and then also around like IP trial designs, so bronchoscopy. There's a talk on the use of virtual reality AI to enhance expertise in pulmonary and critical care medicine, which is very interesting. I know very little about any of that, so I think it would be a very interesting session to attend and learn more about. There's sessions on remote monitoring in basic and translational research topics. And also some sessions that are focused on understanding more basic kind of translational sessions, focused on understanding novel mechanisms for studying chronic lung disease. So it really runs the gamut, but there are several clinically focused sessions that are programmed.
Awesome. And do you know, like, are they programmed sort of at the same time as some of the other stuff, or is it more sort of early morning, midday, kind of later? It's so hard to get to everything that you want to get to.
Yeah. So a lot of the sessions, no, it's a great point. A lot of the sessions are programmed in the morning. I would say there's one very early. I saw a 7 a.m. session, but most of the sessions are sort of in the, early to mid morning, a couple around lunchtime. There's really not so much in the later afternoon. So a lot of the stuff is programmed around the same time that other things at the conference are programmed.
Okay. And then I guess that sort of brings me into the next kind of wrapping up here is, we've heard there's so much content, and this is just within clinical problems, and it's just touching out sort of on the highlights of it. Where can we figure out, like, how can we start planning our meeting and figuring out where all these sessions are happening? How can you like search and make sure you get the most out of your conference in San Francisco?
I think the best way ahead of time before the final program is published is to look at the preliminary program, and you can kind of search by your keywords and just kind of figure out the days that everything's happening. And then once the final program is out, you can use the app to organize your day, and it'll tell you, where the sessions are. You can filter by day or assembly type session and basically build your entire conference through that.
And the app generally syncs with your calendar, so that's an added bonus of using the app. Yeah.
Or you can go old school like me and have an Excel sheet that you look at way too often because you're not savvy enough to use an app.
Go even older. I do it on paper. I write it down. I carry it in my pocket.
In terms of the SIC, all those talks are also listed. They'll be sort of within the content, but I know when the CP newsletter goes out, there will be a schedule of those talks. So if someone wanted to take a look at like exactly like what are, how is this different than, when we're sort of trying to separate what's what, there'll be a list of those talks within there.
Great. I think we've covered a lot of like all the content. I think just to wrap up this session, I wanted to ask you all, just for anybody who's listening and maybe has not yet submitted an abstract or not submitted a proposal to one of these, what you all might suggest or recommend. Like, what is the benefit to participating and presenting your work or coordinating a session like this at the American Thoracic Society meeting?
I can weigh in. I think that depending on where you are in your stage of training, if you're just starting off, just getting something in so that you can at least present even something in progress, or even a case report so that you can start to get to know people in the field, I think is the most immediate benefit. If you're more farther along in your career, then presenting the research that you're otherwise publishing is a great way to increase visibility and kind of get real-time feedback. And so I think there's many different reasons to submit your work, and that's for original research. There's also great reasons to submit, the symposia proposals, meet the expert proposals, to get more involved and essentially disseminate ideas, because that's how we advance the field.
I agree with Justin. I think one of the things, and sort of to highlight one of the things that Justin said that I find really valuable about presenting research at the conference is the feedback, that you receive, because you're sort of, when you're at your institution, you're in your little bubble, and everyone knows your work, and when you get feedback from people from the outside, I think it's incredibly valuable, and that's been some of the best feedback that I've gotten. That's really stuck with me to help me advance my ideas and sort of improve. So I think it's really invaluable, and the networking, collaboration, things like that.
Yeah, I think the presentations in whatever format, including the thematic posters, I think you get a lot of good questions from people who are genuinely interested in the science, and also you get to know people's different perspectives. And then oftentimes I've gotten my best research ideas from people who ask questions, which, make you think of more about it and then advance the science.
I'm a classic example. My very first ever presentation at a conference was a case report in 2011 at ATS. And that was a really good opportunity just to sort of get my foot in the door and realize what this big meeting was all about. And I just at the end here wanted to put in a plug, because after the conference, there's quite a short timeline actually. So if anybody's thinking about submitting a scientific symposium or a Meet the Expert seminar or anything for the conference, those deadlines actually come up relatively quick, I think, after the conference. I mean, not for abstract submissions, it's always in the fall. It's usually November 1st or something like that. But for the other sort of bigger sessions, the proposals actually need to be submitted usually by the end of June. So it's always good when you're at the conference thinking, oh, what would I like to see? And do I want to put a proposal in?
Yeah, and it comes in hot right after the conference. So start thinking while you're there.
Well, Dr. Bhatt, Dr. Oldham, Dr. Aronson, thank you so much for joining us today and sharing all your expertise and insights. And we'll see you all very soon in San Francisco.
Thanks so much.
Thank you. Thank you for having us.
Thanks for having us.
Thank you for joining us today. To learn more, visit our website at thoracic.org. Find more podcasts from the ATS assemblies on YouTube. Don't forget to like, comment, and subscribe so you never miss a show.